general growth curve applies to skeletal growth as a whole, the muscles, the thoracic and abdominal viscera. After birth, curve shows four distinct phases. A rapid increase during infancy, that is especially during the first year, weight increases from 3.5 kg to 10.5 kg, and it accounts for 30% of the total growth. The second phase is a slow progressive growth from 3 to 12 years of age. During this phase or period, boys are taller than girls. By the end of 12 years of age, growth reaches 60% of the total growth. And third phase is a marked increase in growth occurs at the time of puberty and also called as pubertal growth spurt. It appears earlier in girls and hence girls mature earlier than boys. Thus, rate of increase in height and weight is greatest in girls at 12 to 14 years and in boys at 14 to 16 years. In girls, increase in the weight is mainly due to increased fat formation, and in boys, it is due to increased muscular growth. In fourth phase, even though pubertal growth has finished at the 18 years in girls and 20 years in boys, a small growth occurs until the age of 30 years. Thus, in humans, there are two periods of rapid growth phase, that is, first occurs in infancy, and probably that is partly a contribution of the fetal growth period, and the second occurs at the time of late puberty, just before the growth stops. Certain parts of the body have distinctive growth curves. In both sexes, the rate of growth of individual tissue varies, and these are mainly of three types, that is, neural type, lymphoid type, and reproductive type. Neural type, here there is a rapid initial increase in the size of the brain, spinal cord, and organs of special senses. They reach 60% and reach 90% of adult size at 2 and 6 years of age respectively. Lymphoid type of growth pattern. Lymphoid tissues including thymus, tonsils, and lymph nodes throughout the body grow rapidly nearly in early childhood, that is 40% of the adult size by the age of 2 years, and reach their maximum size at puberty. And after this, lymphoid tissue starts degenerating. Reproductive pattern of growth. The gonads and accessory organs of reproduction remain underdeveloped until puberty, when very rapid growth begins and continues throughout the adolescence. The reproductive system atrophies in women after menopause. Note that certain organs show different type of growth, for example, adrenal glands and uterus. These organs are relatively large at birth, then they lose weight rapidly and then regains their weight just before puberty. So this is a diagrammatic representation of the pattern of development of different tissues, that is lymphoid, brain and brain tissue, the body visceral organs and reproductive organs. Lymphoid tissue mainly at the age of peak occurs at the age of 12 years, whereas brain tissue grows in early infancy. Then the body visceral and reproductive organs, they are mainly growth peak occurs at the puberty. There are factors affecting the growth. So these are mainly the genetic factors. Genetic factors are very important in relation to growth and stature, and they are mainly responsible for certain racial differences in the height. For example, achondroplasia. The timing of adolescent spurt in both males and females appear to be genetically controlled via hypothalamus. Nutritional factors. The food supply is the most important extrinsic factor affecting growth. The diet must be adequate not only in protein content but also in essential vitamins and minerals and in calories, so that ingested protein is not burned for energy. Once the pubertal growth spurt has commenced, considerable linear growth continues even if caloric intake is reduced. Diet deficient in quantity and energy in proteins, minerals, and vitamins inhibit growth markedly and adversely. Therefore, if the lack of diet is sufficiently prolonged, the stunning of the growth may be irreversible. And if the lack is less severe or for shorter period, restoration of normal diet leads to compensatory increase in the rate of growth. Undernutrition affects the growth of different organs and tissue unevenly. Environmental factors also play important role, like diseases. Ill health causes temporary depression of growth, but uh, recovery loss is also regained. Thus, following illness and starvation in children, there is a period of catch-up growth during which growth rate is greater than the normal. The accelerated growth usually continues until the previous growth curve is reached. Exercise, repeated exercise of skeletal muscles can increase their mass by producing enlargement of the individual fibers. Emotional disturbances can cause decrease in the rate of growth in children taking an adequate diet. Old age also has an impact on the growth. Aging is characterized by cellular degeneration due to degradative changes in the properties of multiplying cells and impairment of various functions due to the loss of non-multiplying cells. Hormones play an important role in the growth. Contribution of the hormones to growth after birth, especially during rapid growth and during infancy, it is mainly by the growth hormone and thyroid hormone. And during spurt of growth at puberty, it is mainly by growth hormone and androgens. And in between continuous growth, it is thyroid hormone and growth hormone. And after attainment of puberty and rest of the life, the thyroid hormone, growth hormone, androgen plays important role. Growth hormone in utero and neonatal growth are independent of growth hormones. Clinical features, if growth hormone deficiency occurs, is normal. There can be normal birth weight, but subsequent severe retardation of growth, and there will be tendency of obesity or low fasting sugar, and delayed recovery from insulin hypoglycemia can occur. And thyroid hormone is also very important. It is necessary for completely normal rate of growth hormone secretion. Hypothyroidism decreases the synthesis, storage, and release of growth hormone and retards growth. Thyroid hormone has a widespread effect on ossification of the cartilage, growth of teeth, counters of face, and proportion of body. Cretins are therefore dwarfed and have infantile features. Patients who are dwarfed due to panhypopituitarism have features consistent with their chronological age until puberty, but since they do not mature sexually, they have juvenile features in adulthood. Note that growth hormone and thyroid hormone show permissive action, that is, either of the two cannot produce normal growth, but when administered together, they will stimulate growth, possibly via potentiation of the actions of somatomedics. Androgens in males, mainly testis and adrenal cortex, whereas in females, the androgen sources are adrenal cortex and ovaries. It is a protein anabolic hormone and it is responsible for growth spurt. The androgen produces increase in the growth hormone secretion that in turn increases insulin-like growth factor 1 secretion. Although androgen stimulates growth, but ultimately it terminates growth by causing epiphyseal closure, thereby decreases the linear growth. Estrogen have similar effect due to the stimulation of androgen secretion by adrenals. Sex steroids, that is estrogen and androgen, stimulate both synthesis and release of growth hormone, which in turn increases insulin-like growth factor secretion to cause growth. Others like adrenocortical hormones exert permissive action on the growth, and insulin as an anabolic hormone also plays important role in the growth. Diabetic children fail to grow because of increased breakdown of proteins and fats. There are some difference between pituitary dwarf and hypothyroid dwarf, that is cretin. Pituitary dwarf, there because of the growth hormone deficiency in childhood. Cretin is because of thyroid deficiency in childhood. The mental activity is normal in pituitary dwarf. Cretin is mentally retarded. Pituitary dwarf, they are sexually mature, whereas hypothyroid, they are sexually immature. pituitary off, different parts of the body are proportionate, but in cretin, there is a disproportionate body, that is upper segment